What's up, guys? How's it going? Today we'll be talking about tonsillitis and tonsillectomy. Guys, tonsillitis is inflammation in the tonsils. So these are masses in the mouth and the lymph, and these can contribute to basically they're good for your immune system and they contribute to antibody formation. Tonsils are highly vascular, which helps them protect against infection from foreign materials, viral or bacterial organisms that enter through the mouth. So, guys, tonsils are very important. Tonsillectomy, guys, is when you remove the tonsils. Guys, anything with the last word ectomy is usually removal, surgical removal. So tonsillectomy, and for example, appendectomy, right? When you get the appendix removed. So anything with that ectomy is meaning removal usually. So guys, tonsillitis is when there's inflammation, and this can be very serious. This can cause, problems swallowing, and some signs and symptoms include red swollen tonsils, white or yellow coating or patches on the tonsils, sore throat, difficult or painful swallowing, fever, enlarged tender glands in the neck, a scratchy or muffled throat, bad breath, stomach ache, neck pain, stiff neck, headache. In young children, you might see, drooling, refusal to eat, or, fussiness, right? Some causes are usually from, bacterial infections, viral infections, streptococcus, or other strands of strep can also cause tonsillitis. And some risk factors include young age. So ages from 5 to 15 are the most common, and frequent exposure to germs. Some complications, guys, you can get that swelling, and that can cause sleep apnea or disrupted, breathing during sleep. And another complication is the infection can spread even to the kidneys or whatnot. And infection can result in the collection of pus behind a tonsil. Guys, prevention includes washing hands, avoid sharing food and drinks, replace toothbrush after being diagnosed with tonsillitis, and some treatment. You're going to want to, get diagnosed first before the treatment. You want to inspect the throat, check for rash, check for, symptoms, listen to their breathing with a stethoscope, check for enlargement of the spleen. You can do a throat swab. You can get the complete blood cell count, see where those white blood cells are. If they're above 10,000, that could be indication of a infection. Treatment, you want to encourage rest, provide adequate fluids, provide comforting foods such as warm liquids, broth, warm water with honey, cold treats like ice pops that can soothe the sore throat. You want to prepare a saltwater gargle. You want about 1 teaspoon of table salt, and that can help humidify the air, offer lozenges, avoid irritants, treat pain and fever, antibiotics, and even you're gonna have to get surgery. That's obviously the last thing you want to do, because tonsils actually play an important role in taking care of your immune system and preventing illnesses. So surgery is one of the last options, but it is something that sometimes has to happen. So guys, you want to expect bad mouth odor, mouth breathing, snoring, nasal qualities in the voice, fever, tonsil inflammation with redness and edema. You can administer medications such as hydrocodone, antipyretics to decrease the pain. And obviously you want to be aware of allergies, and you want to make sure they're taking the appropriate dosing. You can administer antibiotics, and you want to be aware of allergies. And guys, there's tonsillectomy, where you have to maintain the person on NPO status. That means no eating, drinking. You want to facilitate, after the procedure, you want to facilitate drainage, elevate the head of the bed when the child is awake, or whoever's awake. Assess for evidence of bleeding. Guys, so if there's frequently swallowing or clearing the throat, guys, that could be an indication of there's bleeding, right? And bleeding can lead to excessive blood loss, like a hemorrhage, and that can be very bad. Which is including, you can see tachycardia, fast heart rate, a white pallor, like kind of where they look like they're gonna pass out, a light pallor. You gotta assess the airway, vital signs. You wanna monitor for difficulty breathing, or, are related to oral secretions or edema or bleeding. You wanna administer liquid analgesics or tetracaine lollipops, provide an ice collar, offer ice chips, administer pain medication. And for a diet, you want to encourage clear liquids. You want to make sure they have the gag reflex, and before they get back on food and liquids. You want to discourage coughing or throat clearing or nose blowing to protect the surgical site. You want to avoid straws because that suction can basically, damage the incision site. And you want to notify the provider or doctor if red bleeding occurs, and you want to make sure the patient gets plenty of rest. And you want to report any problems, and usually recovery takes about 14 days. You want to have the patients rest. You want to make sure they intake plenty of fluids, soft diet, and you want to make sure that the patient doesn't put anything in his mouth to mess up with that surgical incision. Some complications include hemorrhage, so you want to make sure you have a good light source and observe. You want to look for any hypotension as a manifestation of shock, and you want to contact the provider, or you want to contact the provider immediately for any of these to get further instruction. Client education. You want to instruct family to report any indications of bleeding, frequent swallowing, clearing of throat, because that could be an indication that they're bleeding in their mouth. And then another complication is dehydration. So you want to encourage oral fluids, monitor eyes and nose, increase intake of oral fluids, and observe for manifestations of dehydration. And another thing, guys, is chronic infection. Chronically infected tonsils can pose a potential threat, and some children who frequently have tonsillitis can develop other diseases such as rheumatic fever or kidney infection. You want to seek medical attention when the child presents with manifestations of tonsillitis. Guys, so that is tonsillitis and tonsillectomy. And I think the biggest thing I learned is you want to monitor if they're bleeding in the mouth, and how that incision site is handling, and making sure their gag reflex comes back before they get food, and just monitoring how they're recovering. So anyways, guys, thanks for watching. Subscribe.